Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Hello and welcome back to another episode of Daktari Tone podcast, where voices, perspectives, and sounds from health practitioners are being amplified. Today, I'm your host, Rian Hilary Kerubo, and today we're going to be talking about something that is fast growing, not only in Kenya, but globally, from Botox, lip fillers, antioxidant therapy, right? And yeah, more around that area. Today, I'm glad to be joined by Dr. Arshni Malde, an aesthetic and regenerative medicine specialist, to tell us more about that area. And yeah, let's dive in. I'm really glad to have you, and thank you so much for having us today.
Thank you. It's a pleasure to have you here.
Yeah, and I really hope it's really going to be a very learning and, interesting. Actually, it's a really interesting area, and I'm glad that I'm going to learn a lot from you.
Thank you.
Yeah, so if you could tell us something about yourself first, if you could start by that, and yeah, from there we can now just...
My name is Dr. Arshni Malde. I practice aesthetic medicine. Just actually having a turning point more into regenerative medicine as well as functional medicine, because that's the way forward with the future. And I practice here in Nairobi. I wear 3 hats actually. I run TIA Institute. So we train other doctors, other specialists on aesthetic procedures, regenerative medicine, functional medicine. And we also have a pharmaceutical company whereby we sell all products related to aesthetics, regenerative medicine, and functional medicine. So a lot that I do, but yes, I'd like to tell you more in our conversation.
Interesting. How did you get into aesthetic and cosmetic medicine?
Back in the day, I was associated with Bollywood, and yes, I was in India, practicing in India, and I was fortunate enough to have Priyanka Chopra Jonas as my boss. Her parents are doctors, and so I was handling their clinic, and I got exposed to the whole of Bollywood, understood that this is such a need. Came back to my own country. This is where I've been born and brought up. So came back here, felt there was a need here, and started the aesthetic medicine journey. Of course, we have so many pioneers already in the industry, but I felt like I could give more I could give more and give more back to my country. And so being exposed to Bollywood, I felt like, or I learned that it's a whole new game. So I came back 2020, COVID time, sadly. But yes, brought back aesthetic medicine and then wore the other 2 hats.
Mm-hmm. And how is it being received here in Kenya in the transition? Because what I'm getting is that transition from now practicing in India and now coming to Kenya.
So initially it was a rough road. Of course, we had so many stigmas, we had so many stereotypes. We would do hair transplants. Patients would say or have questions like, will I get brain tumor from hair transplant? Or will I get cancer from laser? And so it was a rough road initially, but I think a lot of the audience, a lot of patients are so educated nowadays. They know everything, up to a point where the patient will come and tell you how to do the procedure, which is a good thing because we don't have to put in that much effort. Of course we do, but to explain to them that what's right and what's wrong and what will not go wrong, so to say. So yes, it was a rough road initially. I think the exposure now is quite a bit. The demand is quite a bit. And so we have patients coming in for various procedures. We're able to even, do all these procedures and prove ourselves. And yeah, it's a good journey.
If you could mention but a few, what services do you offer, using both scientific terms and down to at least an understandable term, layman? Yes.
So we do Botox, fillers. I think everyone knows that. We also do non-surgical facelifts. this is now where we don't do surgery. So we're not cutting you open, but we're doing something which is a facelift, but is non-surgical. It's a big trend nowadays. Of course, not everyone is a candidate for it. Everyone has their own space. We also do hair transplants. We do a lot to do with what is, not invasive. So we do procedures like chemical peels. We do procedures like skin tag removal, a huge need for keloid removal, because a lot of patients come in with keloids for whatsoever reason. We do scar removal because that's a big demand here. We do something called skin brightening, and I'll repeat, skin brightening, not skin whitening. There's a huge difference, a huge stigma, a huge confusion, I would say, in relation to skin brightening and skin whitening. Yeah. So these are the procedures that we do.
Okay. Before we dive in now to those procedures, you mentioned that you are from India first and then Kenya, which I get to understand, if I'm right, that's different skin from what you're used to, of course, lighter, and hair. Our hair is type different. Is it something that is significant in your area of practice, or?
No, because India was the eye-opener for me for skin of color. I feel like a lot of doctors who've trained in the West find it harder to treat skin of color. By the way, South Indians are darker than Kenyans.
Yes.
So nothing like it was different for me when I came back home, because I had seen skin of color. We were trained on skin of color. We had the experience on skin of color. And that's where my expertise falls in, because I do treat skin of color, and everything works around skin of color.
Mm-hmm. Now, more about Arshni Malde. Tell us about your typical day. How does it look like?
Oh, my day is busy. I come in around 8:30 in the morning. I do quite a few consultations throughout the day, a few procedures here and there. I have a very well-trained team. And like I said, I'm also focusing on the pharmaceutical side. So I handle that as well, sitting at this same desk, doing everything. I do have a few students here and there, and so I'm training them simultaneously while treating patients. But it's a good day. We do get to see all types of different cases. We do get to do all different kinds of treatments. And I have a wonderful team, excellently trained, so they're able to help me out through and through.
Yeah, I could agree with that, because how they welcomed us here was really amazing. And something I'm going to tell you people is that this place is beautiful. It's aesthetic before you get aesthetic done to you. So what do you enjoy most about your work?
I love doing facelifts, but that's not something we do so commonly. However, I love injecting. If I don't get to use a needle during the day, I feel frustrated.
I thought I would be your first. I hate needles, honestly. I'd rather go for medicine. I'd pop those tablets.
I think that's what most people feel. But we've tried to make it a concept of painless. Just as you said, we're so aesthetic, not just the facility, but even the services we do. And aesthetics is all about looking good, feeling good. So it has to be totally painless. And so you can come to us. We'll assure you there's no pain at all.
Okay. Tell us that one myth about your field that makes you laugh every time.
Funny questions. Will I get brain tumor from hair transplant? Will I get skin cancer from laser? How does it work on darker skin type? Of course, there's so much that is advanced now that we have ensured that everything that we do works on darker skin type. But yes, also, the funniest one is, how experienced are you? How old are you? Yes.
Okay, so I believe the first few questions that you asked, the answer is no. So I wouldn't get a brain tumor.
Not at all. Not at all.
Okay, just to have that out and clear. Now, as I mentioned, there's a big surge and very many people coming in for the aesthetics and cosmetic, needs and regenerative medicine. I had a hard time with that one. What do you think is fueling this growth, particularly in Kenya?
Social life. I think we all just want to look good. I do have patients, I'm not saying it in a bad way, who would rather look good than put food on the table. So, and that's the demand, because everyone wants to look good on Instagram these days. You better have money to look good, but not have money to do anything else. So I think it's just us socially, generally, that we want to look good. You know, back in the day, it didn't matter whether you were big, you were small, you were asymmetrical, you were dark, you were light. It didn't really matter because no one was judging you for that. But it's just also everything that's on the internet, because there's a lot of standards that are being set on if you look good is when you're given importance. And so I think that need brings a lot of people to us and them wanting to transform themselves.
And do you think Kenyans are being more open about beauty enhancements?
Yes, definitely. In a way, they're embracing it, they're getting it done, but they don't want to talk about it.
Okay.
Yes. They won't say that I got this done. They want to make it look like it's natural. Yes. Whereas in the West, they readily accept whatever they've done and put it out there, which also allows doctors to educate other people. Unfortunately, that's the drawback we have here. If someone comes to me and gets a procedure done, they don't want to expose themselves and say, oh, I got this done is why I look good. They want to make it look like it's a natural thing, but it's not true. It allows us to educate other people. And so it would be nice if, patients can talk about their journeys, because it's a good thing.
And what trend do you think is here to stay and the one that is going to, be done with?
Oh, body enhancement. I think it's also culture. But for me, I don't believe in looking completely different from what you are. I believe in having good skin, good hair. Something that's sustainable, something that's going to stay with you forever, something that you can, stick up to without ripping your pockets and going bankrupt. So, but yeah, that's why we're here. That's why I've also devoted into regenerative medicine and functional medicine, because we're trying to change the world just from Botox and fillers and, those kind of artificial things, so to say.
Okay. Now, talking about regenerative medicine, what does it mean in this context?
So the term itself explains regenerative, which means it rebuilds anything, regenerates anything in the body. And so we've come up with so many different treatments where, to start off with, we use your own blood, your own stem cells, your own growth factors to probably regrow your hair, make your skin look better, heal your scars. That is regenerative medicine. When I talk about functional medicine, we're talking things that are more natural, where you could lose weight, look 20 years younger, have glass skin, have amazing hair. And so that's the way we're going forward now, without the side effects.
Something that is interesting is that you use my blood, my stem cells, you mentioned, to do this
Procedures.
Mm-hmm. Yeah. So how are these stem cells being used, like in the cosmetic care, if you could break it down? And is it in every procedure that you consider using the blood and the stem cell, or is it just specific to a procedure?
So because I mentioned it's regenerative medicine, we will do it for you, for your skin, for example, for your face, for you to look good, for you to have glass skin, for you to get rid of the pigmentation. We will do it for your hair, to get your hair thicker, to stop hair fall. Mm-hmm. So we're injecting it back into the face, or we're injecting it back into the hair. And we removed your own blood, purified your own blood, and now we're injecting it back. Mm-hmm. And so it's just regenerating that area. And so, you can have glass skin. You can get rid of your pigmentation.
Mm-hmm. Are we seeing more innovation locally, or is it just mainly global?
We do have a lot of doctors embracing it here. I won't say the technology is coming from here. I also learned the stem cells and the regenerative medicine in India. But yes, we are a pioneer here in Kenya, in Nairobi. And I'm probably the first one who started the growth factor concentrate, or the stem cells, in Kenya. And so we're embracing it. I think neighboring countries are looking up to us, just so that we're on the forefront at this point. Yeah.
Are the procedures long term? If I come for this skin tightening or the glass skin, is it something that I have to do it after some time later, or is it something that I'll stay with for a longer time once it's done?
Well, there's maintenance. You can't have your car for 20 years. You have to keep taking it to the garage. Likewise, you have to keep coming back to us for the maintenance, but there's only so much that we can maintain for you. There's a lot of maintenance that you do at home. And so these are more sustainable results. The procedures we do and we want to look forward to doing are procedures that are more sustainable, something that you can now just sit at home and maintain just with basic skincare. You don't have to go all out to retain that glass skin. Yeah.
Okay, now about the risks and the safety of these procedures, what are some of the real risks in this field that clients overlook?
So the good thing, moving into regenerative medicine, functional medicine, there are no risks. There are no side effects. That's what I look forward to. Yeah.
That's hard to trust, but anyway, okay.
Well, I'm taking your own blood, purifying your own blood, and injecting your own stem cells back into your skin. You have nothing to lose, nothing to go wrong. As compared to if it would be Botox, you can be botched. If it would be a filler, you can be botched. If it would be a filler, it's something that will stay in your body for years to come. So yes, as we move towards the regenerative side, we're looking for a lot of things which are natural, maybe not 100% results like the Botox and the fillers and the facelifts and whatnot, but it's long term. It's something that you can sustain with. Yeah.
And how do these, because you've talked about the botched procedures, why do botched procedures happen?
One big thing, unfortunately, quacks. But I won't want to emphasize on that much. But yes, be careful of where you're going. Just ensure that you're in the right place. Remember, cheap is expensive, and I think that's where we all head to. Everyone wants to look for cheap options to look good, but then end up ruining their skin so bad that they have to come back to us to rectify and spend even more doing that. The other reason for botched procedures is maybe just that demand of you will walk in as a patient and say you want to look like this and that's Pamela Anderson. Mm-hmm. You can't. There's so much to consider. And so unfortunately, trying to meet that need, we may go wrong. But I think the best part is just look for someone who's qualified enough to do these procedures.
Mm-hmm. Other than just the quacks, what other reasons are there that botched procedures can happen?
Unfortunately, in aesthetics, you can't botch someone. Yeah, there's nothing that can go wrong unless you don't know how to do the procedure as a practitioner. So no side effects, no botching, nothing actually, just to be in the right place.
Do you think there's enough regulation around the people who could do these procedures?
Yes, definitely. I think our authorities are quite strict. It's just that there are some people who try and do things the wrong way, but I really appreciate how just in Kenya we have so much of strict regulations, and I think that really helps a lot of us to practice the right thing.
Mm-hmm. Okay, so now ethics. As Dr. Arshni, where do you draw the line between a patient's true need and a cosmetic want?
I'm never about the money. Mm-hmm. If I can't do it, I'll tell you I can't do it. If I can't deliver the result you're expecting, I'll tell you I can't do it. There are times I've gone out of my way just to treat a patient for free also, just to prove myself and that this works because, as you know, you'd also barely heard about regenerative medicine, and that's what we're trying to voice out. But definitely, I will never go out of my way to do something just because there's a need from the other end or there's pressure for whatsoever reason.
So that means you say no to a client?
So many times. And I tell my girls, my staff, I'd rather have a sound sleep than do something that's out of my scope because I don't want to have a sleepless night knowing that I did something wrong to someone. It's your life at the end of the day.
And you mentioned something so important about money, being about money, how do you really stay grounded in a field that is really, very highly commercial?
Unfortunately, that's where I have problems, I would say. My treatments are quite expensive, only because I use the right products. And as I mentioned, cheap is expensive. And so I draw the line when someone comes in and says, I want a procedure for 5,000, when the procedure is actually worth 30,000, I will not do it. Yeah.
Okay. And in that line, because of course it's really expensive, that separates, the clients who would even visit more often. So would you say that these procedures are more for the elite, or could we work more around inclusivity?
I would say they're more for the elite, but I do offer services for, I would say, the lower to middle class as well. But not where you're coming to look for a procedure that costs a few 100,000 shillings and you expect me to do it cheap. I will have other options for you which are cheaper, probably not the same result, but you won't go back empty-handed. But yes, so we cater to everyone because everyone has the need to look good.
Mm-hmm. What policy gaps do you think or do you see in Kenya that need urgent attention?
I think a lot of practitioners look for shortcuts, and I really try to push, even through the institute, trying to tell my students that the right dosing, the right way, the right treatments are what you should advocate for. Only because if you're not delivering results, what's the point of taking that money at the end of the day? And I urge doctors to advance themselves, because it's not, you can't just stick to the mortar and pestle way of doing things. You have to advance yourselves and always be learning and doing everything that's, in the forefront in the Western world that we should adapt to.
Mm-hmm. And what advice would you give to someone who would want to come into this field?
Please come. Okay. Only because there's enough fish in the sea. Also, I think a lot of Kenyans will get that assurity when the treatments are more available with more doctors, because then they won't be questioning like, what's regenerative medicine? If you have 100 doctors doing regenerative medicine, they'll accept it because they'll know that there are results from this. And so I think we'll be able to treat a larger amount of the population, and nobody has to go to look for Turkey or the US or India or whatever. I want us to be the hub for Africa.
Mm-hmm. What is your go skin care tip we all need to hear?
Sunscreen.
For real?
Anytime.
Funny enough, I've ever want someone not to keep on using sunscreen.
Why?
Okay. There's a story I did around skin. I'm trying to remember because I've done multiple. It was around, I can't quite well remember, but then the dermatologist did advise it's wise for us to use a lotion on our skin more than the Vaseline product. Mm-hmm. Vaseline. And for the sunscreen, someone might get used to it. And why I'm saying this is because I have a younger sister who kept on using it, and sometimes it could affect her when she's in lack of it.
True, but not true. Are you not going to get used to the lotion?
Well, lotion is quite, because if I'm to get a few bottles in in 1 month, I'll get to use like 2 bottles max. But then it's something that I can still have when it comes
to affordability.
Yes, and also why I also told her to stop is because the temperatures of where we were at the moment were low temperatures.
All the more reason for you to use it.
For real?
Yes, it's not just about the sun. Mm-hmm. It's about the UVA and UVB rays. And so when it's cold, it's the UVB rays affecting you. When it's hot, it's the UVA rays affecting you. And so you have to ensure that your skin is protected at all times. Remember, we're at the equator. This is where the sun is affecting us the most, or the UVA and UVB rays are affecting us the most. This is the biggest myth or biggest stigma that we have, that because we're dark skinned, I won't talk for myself, but most of the population here, we don't need sunscreen. That's not true. You're also just as, prone to be affected as we are as light skin. And so sunscreen every single day of your life. And I think that's where we all go wrong. We haven't done sunscreen for years to come, only until we understand how it works. Just so you know, we have a sunscreen that helps block the UVA and UVB rays. It doesn't have the white cast. I think that's where the biggest problem comes in with darker skin types, the white cast. So when you apply a sunscreen, you have that whitish look, and that's what puts down everyone thinking like, I look really bad with it. It's also very oily, so anytime you put on makeup or anything, it'll just drip down. So we've been able to formulate products for darker skin types, and so our sunscreen is one of them. And please, that is the first step to anti-aging. That is the barrier for everything, makeup, skin, products, everything. Yeah.
Okay, so as you've had, our take-home advice is sunscreen. Sunscreen.
All day, every day.
Okay, so you don't have to apply we have how the way we have medicine prescription. Do I have? Is it every time I wash my face?
Maybe yes.
Which is twice a day. That's morning, of course, and evening when I get back home. So
evening, no. Maybe a bit of the light that you have that is affecting your skin, but not the UVA and UVB rays, to be precise. But yes, morning, the minute you're done with your shower, you have to apply the sunscreen. You don't have to do it in the evening. There are these rules by other practitioners, other brands that say every time you wash your face, even if it's in the middle of the day, reapply your sunscreen. Yes, if you're going to be out and about, do so. If not, it's okay.